Good day, everyone. My name is Dominic Fisher, and I am a physiotherapist. I am the first year coordinator at the Division of Physiotherapy at Stellenbosch University, and it is my pleasure to present the undergraduate program to you today. So the aim of this presentation is to give you an insight into what physiotherapy undergraduate teaching and learning is all about at Stellenbosch University, and also what a career in physiotherapy might mean for you in future, so that you can make the wise decision in choosing Stellenbosch University as your higher education institution. Many of you may have already encountered physiotherapy during the course of your lives, either following injury during sport or just an accident at home, or you may have had the misfortune of having to spend some time in hospital following a period of illness, and you encountered the work of a physiotherapist in getting you out of bed for the first time, helping you cough and improving your breathing, and then taking those initial steps back to full return to your normal function. Physiotherapy is a professional degree, and we are governed by governing bodies in South Africa, namely the Health Professionals Council of South Africa, as well as the South African Society of Physiotherapy. The SASP is also under a world governing body called the World Confederation of Physical Therapy, and it is they who define physiotherapy as the provision of services to people and populations to develop, maintain, and restore maximum movement and functional ability throughout the lifespan. It includes the provision of services in circumstances where movement and function are threatened by the process of aging or that of injury or disease. And that is exactly what our undergraduate program trains the students to do during the course of their stay at Stellenbosch. Physiotherapy core business is certainly around the concepts of movement and pain, and physiotherapy sees full and functional movement at the heart of what it means to be a healthy person, and healthy people make healthy communities, and healthy communities make for healthy nations. The central aim of physiotherapy is, of course, therefore, to restore optimal function and reduce the impact of dysfunction. And that may look very different depending on your context. You might set yourself the goal of traversing a cavern, a valley, or a cliff face on a tightrope, and need assistance with physiotherapy to develop your sense of proprioception and balance in order to be safe and successful in that particular goal. Or your goal might be to be able to walk more efficiently with less pain and less energy expending. And physiotherapy has a role to play on both ends of that particular physical activity spectrum. Physiotherapy as a profession is often characterized or described in three broad areas. These are the medical and surgical area, which is when you might find yourself in hospital either as a result of illness, such as COVID-19, or following surgery. Perhaps you needed your appendix out, or once you had some sort of internal surgery to your abdomen, as in the graphic on the left. The other area of physiotherapy that has been described, and many of you may know, is the area of orthopaedics or neuromusculoskeletal physiotherapy, where you might have an injury or dislocation to a joint, a muscle tear, or an injury to a nerve, perhaps. The other area of physiotherapy is neurological physiotherapy, and that describes relates to disorders or injuries related to the brain or the spinal cord. However, in South Africa, you may very be witness in your patients to all these areas being present in one integrated clinical scenario. So, although there are three main areas of physiotherapy, often patients present with all three or more areas of clinical practice at the same time. As I mentioned before, in orthopedics or neuromusculoskeletal physiotherapy, you might have seen the physiotherapist run into the field of a sporting match on television or in the stadium where a player has sprained an ankle, torn a muscle, and has gone down lame, and that relates to neuromusculoskeletal physiotherapy. And often students aspire to a career where they are involved in the sporting environment, although orthopedics or neuromusculoskeletal physiotherapy is a lot more broad than that. As I also mentioned, medical and surgical physiotherapy, where you might encounter patients that are recovering from cardiorespiratory disorders, asthma, or other lung diseases and dysfunctions, or patients that maybe need the care in the ICU following COVID-19 related illness, or patients that may have had post-thoracic surgery and require assistance learning how to breathe again, how to cough, and how to clear their own airways. Physiotherapists involved in the area of neurological physiotherapy deal with patients that have disorders of the nervous system, may have encountered head injuries following car accidents, motor vehicle accidents, or spinal cord injuries, particularly in South Africa. Here, physiotherapists have an excellent opportunity and an honored opportunity of really impacting the quality of life of patients that have suffered or have incurred injuries or disorders of the nervous system. Given that I've just highlighted the three main areas of physiotherapy, it is quite clear that there is a place for everyone within the profession. Whether it is the person running onto the field and tending to the acute injury of an elite athlete, where they are making a snap decision about whether someone is able to continue playing and participating in that particular match, and then going after the match is done and going through the process of rehabilitation and managing the injury. Or you might find yourself working in the occupational health space, where among your duties may be the correct ergonomic setup of the office environment. There are many career options. Physios are found in the sporting environment, in gyms, old age homes, schools, corporate organizations, and, as I mentioned, in the critical care environment in the ICU. So your experience of the undergraduate of physiotherapy training at Stellenbosch University will be a 4-year journey where you will experience, amongst many forms of development, personal development, but also academic development, where in your first year you'll come in post-matric and you will encounter university for the first time. by the time you leave in your fourth year, you would have completed a research project on a particular topic within the area of physiotherapy. We annually select 55 students into the first year cohort, and we are currently at Stellenbosch University developing a curriculum renewal that will be ready for rollout in 2022. So it is an exciting time to join us at Stellenbosch University in the physiotherapy division. So just to give you some insight into the academic program over the course of the 4 years, this is a schematic representation of the modules that you will be required to complete. In your first year, you'll undertake modules within the medical sciences, such as anatomy and physiology, as well as the basic sciences, chemistry, physics, and biology. And that sort of is the foundational component upon which physiotherapy sciences will then be taught. Physiotherapy science extends the first and second year, and during those 2 years, you will learn the very basics of the assessment and the treatment and management of patients with in the realm of physiotherapy. And as you progress through the 4-year program, you will encounter human sciences modules, and we move from away from how the body normally functions in first-year physiotherapy science to how to assess where there is dysfunction in physiotherapy science 2. Once you get beyond that, you will now have to integrate that knowledge into other areas of learning, including pharmacology, pathology, psychology, and sociology, as you now begin to apply the fundamental sciences of physiotherapy into a more applied way, and starting to head towards the real world later in your third year, where you start clinical physiotherapy. So the applied physiotherapy, during that module, you look at how function and movement of the body has been affected through various disorders or illness. And you have to build on what is normal and apply how various systems of the body are affected by various illness and disease, and then try to manage or contextualize how you would manage that particular scenario. And then it becomes quite real. In your third year, you have your first taste of interacting with real life patients. You will be on rotation on the clinical platform within the Department of Health, where you will be exposed to primary healthcare, secondary, tertiary healthcare, as well as community healthcare. And you will rotate during the course of the third and fourth year between various levels of healthcare in various clinical settings, such as community health centers, secondary hospitals, tertiary hospitals, as well as you will have the opportunity of perhaps visiting a school for special needs, or even as an elite sports environment, as well as a community setting. So by the time you complete your rotations in fourth year, you would have started at the bottom, where you were learning about the fundamentals of physiotherapy, and then the fundamentals, medical sciences, the anatomy and physiology, and chemistry, physics, and biology, and how that is, and integrating that with the basic physiotherapy sciences, and how pathologies and the effect of psychology and sociology on those different systems in the applied physiotherapy module, and then integrating into the clinical platform. And as a 4-year Bachelor of Science degree, you will also have the opportunity of developing your own research project and developing a research question that you might develop with in a small group, and you will develop a plan of how you would answer that particular question. You have the opportunity of conducting the research study and also writing up a research report and then presenting your findings in the 4th-year research presentation event that is a highlight of the 4th-year academic program. And at the end, once you have completed all these modules, you will graduate, take an oath, and graduate as a registered physiotherapist, ready for your year of community health service on the Department of Health clinical platform. At Stellenbosch University, we are very honored to have a South African Research Council chair in the area of rehabilitation, distinguished Professor Cornette Louw, and she has a really strong influence on the way that students engage with the program of physiotherapy. We also have sort of distinguished physiotherapy alumni, including former South African Rugby Under-23 physiotherapist Anirin Rabane, as well as Nick Moffat, who is currently a physiotherapist at the Dolphins cricket franchise. And these are just a couple of highlights of staff and former students that have really that really hold the name of Stellenbosch University physiotherapy quite high out in the world of academia, as well as clinically in sports physiotherapy. Well, I hope that you have enjoyed this short presentation about physiotherapy, the physiotherapy division at Stellenbosch University. I hope it's given you information that you may have required about the program and helping you decide to make the wide choice of joining the Stellenbosch University Physiotherapy Division in your journey towards becoming a qualified physiotherapist. So thank you for your attention. Dankie, inkosi.